Patients, when they have a spinal condition, oftentimes wonder, what am I getting myself into? And they'll do all kinds of things, like talk to their neighbor or talk to friends and find out what kind of surgery they had. And if they had a good surgery, they would say, great, I'm going for it. And if their friend or neighbor didn't have a good surgery, they'll say, oh, I've heard spine surgery is not good. And certainly this anecdotal experience has some usefulness. However, generally, the approach that I would recommend is slightly different. I think that patients should realize that in this day and age, we are living older, longer, better, and stronger than we ever did. So patients nowadays can expect that well into their 70s, they should have a very active lifestyle. That's not just something that is hoped for nowadays. It's expected. And the whole world is expecting and visualizing patients having this right, that when they're 75, when they're 80, they should be very active. And the way to do that is to be active when you're 60 and to be active when you're 50 and when you're 40. So the important thing that I try to emphasize to patients is that really as long as there is no major issue with them needing spine surgery, such as a tumor or paralysis, the question is, how can we intervene and affect their life so that they maintain an active functional state away from harmful drugs and medications and harmful behaviors that will lead them to an inactive or poorly functional lifestyle. So if a person is having problems with their spine and their whatever age, 20, 30, 40, 50, and these problems in their spine are limiting their effectiveness and their activity. In essence, if they're disabling them to some extent, not allowing them to participate, not allowing them to be independent, take care of themselves, do the things they have to do, whether it's with their family, with their job, their social life, their recreational life, then there's a time for us to get involved. Now, in our involvement, believe it or not, surgery is the last thing that we'd like to do. We'd first like to see if we can get them to do things on their own, exercises, physical therapy, activity modification, perhaps some mild medications for a short term. These are all things that we can do to intervene at an age that can prevent the spiral of downward disability. And by that, I mean a person starts having limitation because of pain, they stop doing activity, they do less and less, they get deconditioned, that causes more injuries, and then they get to where they're in a poorly functional state. So hopefully if we can intervene at an early age, and an early state of disease, and use one of our non-surgical interventions and get them to be active and functional, we can prevent that unnecessary downward spiral. Sometimes, however, people need more intervention than that. They might need cortisone injections and an aggressive course of therapy or exercise or bracing. Sometimes they might need a surgical intervention, whether it's a microdiscectomy, foraminotomy. These are procedures that take about an hour, allow the person to be out of the hospital either that same day or the next day, and have full recovery within 2 to 4 weeks. Occasionally, a person has reached a stage where they're really very limited and they have a severe structural problem that will not go away without spinal surgery. This person might be young or middle-aged, or they might be older. But if that young or middle-aged person does not have that intervention, oftentimes they are going to have the rest of their life with severe limitations. And in this case, a major surgery is involved. The surgery involves approaches to the spinal cord and the nerves, which can lead to paralysis. And so these issues are very, very important. That's why you have to choose wisely and be fully informed to the best that you can. The important decision is to understand why you're intervening, that it's the right time, that you need to have an operation or an intervention, and that who are you trusting and interacting with to make that decision. Everything in life has risks, and certainly spinal surgery has risks. Specific surgery, spinal surgery risks involve the usual risks of surgery, such as infection, bleeding, risk of a stroke or paralysis, heart attack, pneumonia, any of the kind of problems you would get from generally having anesthesia related to your heart, your lungs, your brain, kidneys, etc. In general, those are going to be about 1 to maybe 3%. If a person has a specific risk or a heart condition, they can be very high, 5, 10, even 20 or 30%. We usually will not do surgery if it's higher, much higher than that. Risks associated with spinal surgery are specific to the nervous system and the bones of the spine. So paralysis, injury to the nerves involving the hands, the arms, the legs, the bowel, bladder function, injury to the brain, injury to any of the ability of the spine, such as motion, flexibility, being able to bend or move, turn. Perhaps the most common risk of spine surgery, and one that patients need to really be aware of, is that the surgery does not help the patient. So a person comes in because they have pain going into their leg. One of the risks involves that the operation will be done, but their pain doesn't go away. And that is a risk of surgery, not necessarily a complication.